Hi, I'd like to introduce you to a completely new technology that helps take the guesswork out of early caries detection. It's called Spectra. It's a non-invasive caries detection device that will help you diagnose caries earlier than ever before. As professionals, we need to offer our patients clear and compelling reasons for their recommended treatment, especially at the earliest stages when there's no pain or discomfort. Today, with the increased use of fluoride and better prevention, caries has become much more difficult to detect. We reach for an explorer, but that's like having a meteorologist go to the Farmer's Almanac and tell us what the weather's going to be like today. What we really need is something new. We need something that's going to make detection easier than ever before and allow us to know exactly what's going on. What we need is Spectra. An explorer may not be what you want to use on some teeth. On recently erupted teeth, taking explorer into a groove may actually cause iatrogenic harm. You're going to crush enamel rods, and where there wasn't cavitation, now you have it. Spectra is a non-invasive way at looking at those grooves and telling whether there's a carious lesion present or not, and it's more specific. It gives you the depth. It gives you information that you would never have with an explorer. In order to use Spectra, first you're going to have to connect the cable, which has already been plugged into the USB port on your computer, and you just plug it into the camera. The computer will recognize that Spectra has been plugged in and the LEDs will light. We now have to place a barrier on top of the camera. And we peel off the excess material. We then take the hood, small side, and place it over the head of the camera. Spectra is now ready to be taken into the mouth and used for caries detection. In order to use Spectra, we need to first isolate the teeth. Dry them, and we launch the Spectra software. Spectra is then taken to the mouth, the hood is placed over the tooth, and an image is shown on the screen. First, we'll be in detection mode. When Spectra's fluorescent light is exposed to the tooth, the porphyrins in the areas that have high numbers of caries-producing bacteria absorb some of the light and reflect back at a different wavelength than the healthy areas. We can see this immediately on the monitor, where the carious lesion appears red or orange in contrast to the healthy green structure of the tooth. In analysis mode, we get these different colors with numerical readouts. An area such as this, where it says 1.5, is caries just in enamel. As we see the colors change here from red to orange and the numbers increase even as we go up, this is showing that the carious process has penetrated through into the dentin layer. When we see these numbers out here, these numbers are just to be ignored. This is just plaque and other debris on the side of the tooth. So what we want is to see nice green healthy enamel, but the areas that are different colors and as the numbers go up are areas that need to be checked more closely. Spectra is a diagnostic aid. Consider it your digital explorer. It provides you the additional information you need to make proper diagnosis and allows you to educate your patient like never before. Spectra, it's 21st century caries detection.